Hello, good people. This is Dr. Stephen Okoro, your physician and health coach. Today we're going to discuss this topic, lifestyle modifications needed for the healing of peptic ulcer. It's a continuation of our series on peptic ulcer. So if you're here for the first time, I advise that you go back to our previous videos on peptic ulcer. We've been able to talk about what is peptic ulcer. Now, what are the symptoms of peptic ulcer? What are the causes? How do we investigate it? How do we diagnose it? And then we talked about the treatment. So today we are going to talk about the changes you need to make in your life so that the treatment you're taking for peptic ulcer will be effective. And the importance of this teaching is that some people think that everything has to do with just taking medications. No, for effective treatment of ulcer, you need to make some lifestyle changes. Now, what are those lifestyle changes? Now, for your ulcer treatments to be effective, I've already said you must be willing to make, those lifestyle changes. What are the changes? You have to avoid irritants. What are irritants? Irritants that are things, items, or even food that tends to irritate the lining. They are called irritants. And when they irritate the lining of your stomach or intestine, they make the healing difficult, or they delay the healing process. Number one is the drugs, the painkillers, the non-steroidal anti-inflammatory drugs. You know them: aspirin, brufen, feldin, naproxen. So, in other words, if you are taking treatment for ulcer, stop abusing painkillers. Take only that which your doctor prescribes for you. You shouldn't be buying painkillers over the counter. Let your doctor prescribe the proper painkiller that you need if you need painkiller. Okay? Then the other one is alcohol. Alcohol is an irritant. Then tobacco. When we talk about tobacco, both cigarette smoking or snuff, any form of tobacco, they tend to irritate the lining of your stomach. Then coffee or caffeinated drinks or chocolate foods or spicy foods like suya, fried oils and things like that, they can irritate your stomach. They are irritants, so avoid them. Then the next one is to eat healthy diet. So apart from avoiding irritants, you need to eat a healthy diet. What is a healthy diet? It should be a balanced diet, mainly plant-based, full of vegetables, high fiber diet, with the correct amount of protein. And then you have to eat them in small portions of food. You don't load your plate. You don't move mountains on the table. Eat small portions of food such that your stomach will not have to labor too hard to handle the quantity of food that you are bringing in. Small portions of food will help your stomach to heal properly. Then you have to avoid late night meals and snacks, especially 2 hours before bedtime. You shouldn't eat. In fact, generally, eating beyond 6 is not even healthy. So when you eat late night meals, they tend to keep your sphincters, the entrance into the stomach open. So acid can flow into your esophagus and cause what we call the GERDs, that is the gastroesophageal reflux disease. Apart from the fact that they will discourage or hinder the proper healing of ulcer, they can equally cause the GERDs, which a lot of people complain about, heartburn when they lie down. You don't need to do that. Then it is also unnecessary to eat more often or to drink more milk. Some people use ulcer as an excuse to eat a lot. It's not scientific. Eat the right amount of food you need, and then eat at the right time, and eat the right portion, a small quantity at a time. And then this is equally, it's not necessary too to be loading yourself with milk. Some people believe that drinking a lot of milk will reduce their ulcer. No. Milk contains fat and protein. When you drink milk, it may, physically coat the surface of the ulcer. But milk contains fat that will stimulate more acid, and it contains fat and protein that will stimulate more acid production by your stomach. And so when there is more acid production, they can hinder the production or the healing of your ulcer. So it's not necessary for you to be loading yourself with milk in a bid to treat ulcer. So foods that help, green cabbage juice, aloe vera juice, they all have anti-inflammatory antioxidants that will help to protect and heal the gastric lining. Then, as I said before, high fiber diet. Apart from having fiber that helps to move food through your stomach, they equally have what we call polyphenols, antioxidants, and even probiotics that can kill H. pylori bacteria. Remember, we said that the commonest cause of peptic ulcer is the bacteria H. pylori. So the food you eat, high fiber diet, will tend to help to eradicate the H. pylori bacteria. So other important lifestyle modifications, you can have a food diary where you will note the things, how your body responds to food. That way you'll be able to identify the things that your body, that tend to irritate you when you eat. You'll be able to note them so that you try to avoid the things that worry you when you eat. So that's the importance of having a food diary. And then, as I said earlier, avoid late night meals, and then eat smaller portions of food. Then most importantly, you have to avoid stress. Stress tends to increase your adrenaline secretion. If your adrenaline bucket is full, adrenaline tends to reduce the healing of ulcer. So anything that tends to increase the adrenaline level, it will ultimately reduce the healing of your ulcer or worsen ulcer conditions. So take time to exercise properly. They help to reduce your stress levels. And then you can reduce your stress levels through meditations. That's what some people do, yoga, tai chi, such things. But you can equally do prayers, having your quiet time regularly. All these things, they help to improve the healing of your ulcer. Then lastly, we talk about follow-up. Follow-up is very important. You don't just forget about going to see your doctor after the initial consultation. When the prescription has been made and you're taking your medication, bear it in mind that you have to go on a follow-up visit, so that he or she will have to see and confirm that your ulcer is healing. And then there may be need to perform an upper GI endoscopy after treatment if the ulcer was in your stomach. And this is actually to make sure that healing has taken place and that there are no signs of cancer. So because there are some cases where you keep taking the medication and the treatment, the symptoms don't seem to be going away. There may be need for the doctor to repeat an endoscopy and then, do biopsy to be sure that it's not just ulcer. If there is cancer, it will be picked up early. So some people may be having cancer and they are busy treating peptic ulcer. So that's the importance of going for your follow-up. So follow-up is equally very important to make sure that the H. pylori bacteria has been eradicated. After the initial treatment, the treatment has been given. You have to wait at least 2 weeks, then go back for the H. pylori investigation to be repeated so that you'll be sure that it has been eradicated. Okay, so that brings us to the end of this broadcast. Next video, we're going to look at the prognosis. You know, how would you, is it true that ulcers have come? You know, people want to think that ulcer is their birthright, or is their second name. They'll tell you, I have ulcer, I have ulcer. Is it a lifetime sickness, or is there an end to it? So if I've added value, or if you've received value from this broadcast, please do not forget to share, to like, and to subscribe. So see you in our next video. Thank you.